Assalamu alaikum. Now I would like to discuss about status epilepticus. First, generalized convulsive status epilepticus. What are its risk factors? It may be non-adherence to anti-epileptic drug. There may be some sort of brain abnormalities like brain tumor. There may be metabolic abnormalities, infection, and drug withdrawal. How we can diagnose a patient with generalized convulsive status epilepticus? Diagnosis is confirmed by 5 or more than 5 minutes of generalized convulsive seizure or 2 or more convulsive seizure without interval recovery of consciousness. So we can diagnose if 5 or more than 5 minutes of generalized convulsive seizure or 2 or more than 2 generalized convulsive seizure without interval recovery. What is its treatment? Treatment is stabilize circulation, airway, breathing. We can use benzos, repeat administration until termination of seizure activity. Uh, Begin anti-epileptic drugs and EEG for refractory status epilepticus. EEG for status epilepticus. Okay, now what is its management? Management of generalized convulsive status epilepticus. First, we need to diagnose 5 or more than 5 minutes of generalized convulsive seizure or 2 or more than generalized convulsive seizure without interval recovery of consciousness. So you need to stabilize circulation, airway, breathing, evaluate for predisposing causes, evaluate for predisposing causes, and gain IV access and administer lorazepam, diazepam, and or midazolam, lorazepam or diazepam or midazolam. So first diagnose, then ABCD management, airway, breathing, circulation, then the drug to stop the seizure. Then we can use adjunctive IV agent. If the seizure persists, then we can add adjunctive IV agent levetiracetam, fosphenytoin, or valproic. If seizure activity terminated, yes, then continue supportive care. If seizure activity does not terminated, initiate continuous infusion of midazolam or pentobarbital or propofol and monitoring EEG monitoring for refractory status epilepticus. EEG monitoring for status epilepticus, for refractory status epilepticus. Okay, a brain has seized more than 5 minutes status epilepticus. It is increased risk of this point is very high cortical laminar necrosis. Why? Due to excitatory toxicity appears as cortical hyperintensity sorry appears as cortical hyperintensity on DWI imaging. If somebody has seizure, if somebody has status epilepticus, how you can confirm through MRI? If you do an MRI, there may be cortical hypersensitivity on DWI film, diffusion weight imaging film. And if you find there is cortical hyperintensity, why? due to cortical laminar necrosis. So you can confirm that it is status epilepticus. Following drug therapy, patient with generalized convulsive status epilepticus typically regain responsiveness in 10 to 20 minutes. Patient unresponsive, persistent unresponsive state may be due to either sedation due to persistent effect of benzodiazepine or ongoing seizure without physical manifestation, non-convulsive status epilepticus. Therefore, to differentiate these two states, EEG should be done. Is it due to sedation due to persistent effect of the benzos, or if it is ongoing seizure is happening, so non-convulsive status epilepticus? We can differentiate these two by EEG. Okay, that's all about status epilepticus. Hope you enjoyed.